What's up, guys? This video is all about heart rate variability, or HRV. Why it's good for you, why you should be incorporating it, what's all the hype about. So heart rate variability is measuring the variability between heartbeats. If we can imagine that 60 beats per minute doesn't mean every second your heart beats. There's some variability within those beats. So that's exactly what heart rate variability is measuring. HRV that is really high or pretty high is a great indicator that your body is ready for a redlining workout. It's ready for whatever you're about to throw at it. Your stress tolerance level is really adaptive, and you can kind of respond to anything coming at you. Whereas a really low heart rate variability probably gives us a good idea that it might be better to do a active recovery day, or that you have too much load in your stress tolerance bucket, essentially. So what we do is most times there's a biofeedback measurement, like a Whoop strap or like an Oura ring, or anything that actually measures heart rate variability. A lot of these biofeedback tools that we have a recovery number, but that doesn't necessarily mean it's telling us heart rate variability. So we want to be really intentional with getting that number, the HRV number, and interpreting that appropriately. So when we talk about HRV and the number that is presented to you, it's going to take about a month to really figure out what your average heart rate variability is, and what is high and what is low to you. So there's no corresponding number to a high HRV, and there's no corresponding number to a low HRV. It's just you over time. So we can only compare you to you. We can't compare you to other athletes or other people using HRV as a metric. When we talk about this high HRV, it's going to be over a 30-day time span. You're going to start to see your highs, and you're going to start to see your lows, and then you can kind of start to really figure out what this range is. When HRV is high, that's a great time to do all of your super hard workouts, really push yourself. It means like you're ready to roll. Whereas if HRV is really low, we really have to start to be introspective and determine like what our body is trying to tell us at that time. Are you starting to come down with something? Are you on the verge of, getting sick? Are you really stressed at work and trying to get all these heavy workouts in? Are you having relationship difficulties and that's playing into your workouts? So if we constantly push on a low HRV, we're going to get in the spot where we start to be under recovered and under prepared for the things that are coming at us, which leaves our immune system tanked, our gut system, at a deficit, and it leaves our body really susceptible to injury. So we want to be really intentional with this tool, and it's an amazing metric that you guys can start to use to determine stress tolerance load and how your body is feeling. With that 30-day time span of really figuring out your range for HRV, that gives us a really good time to be able to, on low days, look in. What is your body telling you? What is this feeling? Can you start to pick up on these cues without using any biofeedback tools? This is the true value of anything, to start to listen to your body and determine when to push and when to gear down. In saying that, there's always time for redlining. So this doesn't mean, and it's an excuse to not train. It's an ability to listen to your body. It's an ability to start to tune in and really figure out those days that you should be pushing it really hard, or days where you should be gearing back a little bit to optimize recovery. So in the next video, we're going to talk about measurements of HRV, and we're also going to do a little write-up for you to explain how to measure your HRV.